What is a health system? You might think of hospitals and doctors and nurses and pharmacists. Today, I'd like to share an idea that's simple, but really transformational in its implications. I'm Chad Swanson, and I'm an emergency physician. I'm on a personal journey to understand and transform our health system. The way we think about a health system today is rooted in ideas that began in the 1890s. The idea is that when someone gets sick, they go to see a doctor, and the doctor makes a certain diagnosis and then prescribes prescriptions, and then the patient goes home. If they get sick enough, they need to be admitted to the hospital. And of course, there's clinics and pharmacies, and over time, those ideas have evolved some. So there's been the emergence of pharmaceutical companies, there's been the emergence of physician's assistants and respiratory therapists, and a number of other professions, but by and large, the overall structure of our health system and how we think of it has remained about the same. As we think about the goal of the health system, we might say that the goal is to improve our health. And yet our health, our modifiable health status is determined 80% of our modifiable health status is determined by factors outside of hospitals, doctors, and nurses, outside of the medical system that we think of. So we're going about this the wrong way. We start out thinking about parts of the health system that we assume are the correct parts, and then we assume that they're going to achieve the goal that we want, improved health, in the best way. And yet, I would argue a better way to think about this, and from a systems perspective, the correct way to think about this is to think about what is the goal of our health system. And the goal of our health system should be optimal health and well-being for all at the lowest possible cost. And if we think about it that way, then we need to include in our health system households, businesses, and churches and synagogues and mosques, and the government, of course, and schools and education and research. And so if we stay relentlessly focused on what we really want, which is the outcome of the health system, then we start to think about and address the health system less like a machine where we need to replace parts, and more like an ecosystem that is continuously adapting to accomplish the goals that we want. Let me just show you the other side here. So currently, we have a health system with a number of subsystems, and one might be clinical medicine. Another might be health education. Another might be health research. Another might be health policy. And each of those is working on goals that might seem to be achieving the final goal, which is optimal health and well-being for all at the lowest possible cost. But they have other aims as well that distract them. For example, in the medical system, we are hyper-focused on episodic rescue care with profit and prestige driving that. In health education, we are hyper-focused on publications and achieving tenure, often at the expense of being nimble and adaptive. In health policy, we're often focused on short-term fixes at the expense of long-term improvement in health and well-being. So a better way to think about health from a complex adaptive systems perspective would have us working together with all these subsystems in a way that achieves the goal that we want, optimal health and well-being for all, at the lowest possible cost, with a shared vision and aligned incentives, keeping all these subsystems in line. There will still be profits, there will still be short-term metrics, but overall, the goal of the system leads to adaptation and ongoing learning from the subsystems. I'd love your thoughts on this. I'm going to be answering questions, the questions that I have, my own questions, and questions that you submit if that happens on a